Hello friends, welcome to our YouTube channel Medical Knowledge. Today we discuss about anxiety and the causes, symptoms and treatment of anxiety. What are the common causes of anxiety attack? Continued stress, relationship issue, financial problems, life transition, difficulties at work, chronic health condition and sleep deprivation. Let's see what is anxiety disorder. Anxiety is a response that is unknown, internal and vague, while fear is a response to a known external definitive threat. This is the difference between anxiety and fear. Fear is a known external definitive threat, while anxiety is a response to unknown internal threat. Anxiety is an unpleasant emotional state involving subjective apprehension, bodily discomfort and physical symptoms. Within the limit, increase in the anxiety increases the performance, but too much of the anxiety decreases the performance. What are peripheral manifestation of anxiety? Palpitation, diarrhea, hyperhidrosis, that is increased sweating, tachycardia, syncope, tingling in extremities, tremors, upset stomach. These are the peripheral symptoms or manifestation of anxiety. Now we discuss about types of anxiety disorder. Anxiety disorders are of mainly three types: generalized anxiety disorder, panic disorder and phobias. First we discuss about generalized anxiety disorder. Generalized anxiety disorder is characterized by generalized, persistent, excessive anxiety or worry about a number of events which the individual finds difficult to control, and it should be lasting for at least 6 months or longer. Characteristic symptoms include cognitive symptoms, apprehension about the future. Somatic symptoms include tension, headache, fatigability, difficulty in concentration, muscle tension, sleep disturbances. Autonomic symptoms include increased heart rate, shortness of breath, increased sweating. Treatment of generalized anxiety disorder is divided into two types: non-pharmacological treatment and pharmacological treatment. Non-pharmacological treatment include cognitive behavior therapy and relaxation techniques. Pharmacological treatment include drugs like selective serotonin reuptake inhibitors, paroxetine, sertraline, fluoxetine, fluvoxamine, escitalopram and citalopram. These are the drug of choice for treatment of generalized anxiety disorder. Beta blockers like propranolol can be used for autonomic dysfunction. Benzodiazepines use limited due to their abuse potential. Buspirone, a 5-HT1A receptor partial agonist, can also be used. Panic attack. Panic attack is discrete episode of intense fear or discomfort and is associated with feeling of impending doom. It develops abruptly and reaches peak within 10 minutes and usually resolves within 30 minutes. 4 or more of the following symptoms are present to call it a panic attack. Number 1, palpitation or increased heart rate, sweating or shaking, shortness of breath, feeling of choking and chest pain. Risk factor for panic attack: stress, family history, change in life, traumatic event, smoking, excessive caffeine. These are the risk factor for panic attack. Symptoms include nausea or abdominal distress, feeling dizzy, unsteady, lightheadedness or fainting. Derealization, feeling of unreality or depersonalization, being detached from oneself, losing of self-control or going insane, sense of impending death or sense of impending doom. Paresthesis, that is numbness or tingling sensation, chills or hot flashes. These are found in panic attack. Pharmacological treatment include benzodiazepines. Benzodiazepine facilitate the action of neurotransmitter GABA in the brain. Some of the examples of benzodiazepines are alprazolam, lorazepam, diazepam, chlordiazepoxide, etiazolam, clonazepam. Sublingual or mouth dissolving clonazepam have a rapid onset and provide immediate relief in panic attack. Now, how to differentiate between panic attack and heart attack? Panic attack is a sharp or stabbing chest pain or choking sensation in the throat. Heart attack Dull pressure below the breastbone may radiate to neck and jaw or down in left arm. Panic disorder. What is panic disorder? Recurrent unexpected panic attack 3 in 3 weeks. It is associated with anticipatory anxiety of having another attack. Relative freedom from anxiety between the two attacks. Treatment of panic disorder include non-pharmacological CBT, pharmacological SSRI as a first choice, benzodiazepine, tricyclic antidepressant can also be used. The third type of anxiety disorder is phobic disorder. Phobia is defined as an irrational fear or specific object or situation. Fear is out of proportion to the dangerousness perceived. Common type of phobias include agoraphobia, social phobia, and specific phobia. Agoraphobia. Agoraphobia accounts for 60% of phobic patients characterized by anxiety of being in the place or situation from which escape might be difficult. Examples include being in a crowd or standing in line, being outside the home alone, being on a bridge, traveling in bus, train. Social phobia. Persistent fear of social situation in which embarrassment, humiliation can occur. Place where person feel that he is being observed. Social phobia is of two types: performance anxiety and generalized type. Performance anxiety. While performing some task, treatment include beta blocker like propranolol and generalized type. Generalized type of social phobia occurs everywhere and all time. Treatment of generalized type social phobia include cognitive behavior therapy as non-pharmacological and SSRIs as pharmacological treatment method. Now the third type of phobia is specific phobia. It is a strong persistent fear of an object or situation. Feared object and situation in phobias are animal, height, illness, injury and death. Various specific phobias are agoraphobia, that is fear of open places, acrophobia, fear of heights, hydrophobia, fear of water, claustrophobia, fear of closed space, zoophobia, fear of animal, allurophobia, fear of cats, mysophobia, fear of dirt and germs, pyrophobia, fear of fire, xenophobia, fear of strangers, cynophobia, fear of dogs. Treatment of specific phobia. Non-pharmacological treatment include exposure and response prevention therapy and systemic desensitization. Pharmacological treatment include SSRIs as the first drug of choice and others, benzodiazepine, venlafaxine, buspirone can also be used.